I was recommended by the University of Michigan. They looked up, it was the neurology, I think, department, and they recommended that I come here. I had PT before, and so I was very impressed with the way the physical therapists actually watch what's going on, and the assistants, how helpful they are. They're all very, very nice, but nice doesn't cut it if they're not fixing the problem. And they have. Like I said, I've been a repeat patient, and each time they fix something, I come up with something else. Mark is working on this one, which seems to be a challenge. This one doesn't seem to want to go away. But the whole time I've been here, and it has been a while, I do notice how they're cleaning up everything. Every piece of equipment that's used is sterilized afterwards. So I've been very impressed all the way around. It was my spine, and I had to have surgery, so this was the aftercare on that. And that was very successful. I had a shoulder replacement in October, and I had Lisa, and then my side. I don't know exactly what was going on, and U of M isn't quite sure either. I had two different diagnoses, so Mark was in the dark when he started working, and he has, after trying a couple different things, come up with something that is working. In my experience, Mark is fabulous. Just fabulous. When he was trying to figure out what was going on, he even mentioned that you could tell that night he was studying, trying to figure out what to do. And that shows in his treatment of the whole thing. He doesn't give up until he's come up with something.
Yeah.
I started with Mark, I started with Mark when he was still a student, studying to be a physical therapist. And even then you knew that was exactly what he ought to be doing. I, first of all, keep telling all my friends that this is where they need to come if they have to have physical therapy. And that is what I pointed out, how the therapists themselves stay with you and watch everything that's going on. I have been to other ones where I think the therapist probably tells the helper, but then off you go and the helper helps you. Where with this, Mark, and again it's Mark because that's who I had, Mark will tell them what to do as he's continually watching, but then he'll come back and say, no, you're doing too much on the left side versus the right, or no, and so he's watching constantly. So and I've always been impressed with that.
Yeah.
Well, again, I've dealt with Julie the most. She's so sweet and so cute and funny. And you know, I talk about Mark, but just watching, like watching Josh, and I've had Lisa. I can't think of the other lady's name. Amy. Just watching them working with their patients, you can see they're getting the same treatments. Has been very, very good.
Yeah.